Hello and welcome. We will get started in just a few minutes. We're just letting people in from the waiting room. We're happy to have everybody here. Welcome, welcome. I hope everybody's having a great Tuesday. It's now 1 o'clock. Stacy, do we have anybody else in the waiting room?
Everyone's been admitted.
Okay. We'll give it just one more minute and we'll get started. Hi, everybody. Thank you for coming to spend this hour with us. Well, let's go ahead and get started. Hi, everybody. Welcome to What Works in Workforce and Can I Afford It? I am your host, Connie Sharp, the Director of Membership for NAWB, and I am happy to present our presenters today. Allan Porowski
Porowski, yeah.
is the Principal Associate ABT Global and the Project Director of Pathway to Work Evidence Clearinghouse. Amanda Danks is the Senior Researcher at American Institutes for Research and the co-director of AIR's Center for Economic Evaluation. She served as one of the key developers of Pathway to Work's new cost standards. And Lorrie Briggs is the Deputy Assistant Secretary of Louisiana's Department of Children and Family Services. She served as one of the Pathway to Work's evidence champions in guiding the direction of the clearinghouse and ensuring its utility for a wider audience. And just before we get started, I wanted to point out some of our upcoming events for the rest of the month. In September, we have our Public Policy Power Up. And we're going to be talking about Department of Labor data. This is a members-only benefit for NAWB. We also have on September 29th our annual meeting. And then on September 30th, we have Skills Rich Future Forward. It's a insights from our community of practice. In October, we have our Vision Partners conversation, which is a members only. We also kick off our How Did They Do It peer learning series, telling our story through data, where workforce boards are going to teach other workforce boards about their innovations and best practices. We have another Skill Up webinar on October 23rd, and of course our Policy Power Up. In November, we have our part 2 of How Do They Do It, advocating for state funding. We have Eastern Kentucky and Simca out of Michigan talking to us about how they advocated their state to put workforce money into their state budgets, and our Policy Power Up. And then, of course, in December, we have part 3 of our How Did They Do It series. And in March, the forum is moving to Las Vegas, y'all. First time we've ever been out of DC. We would love to see you there, so mark those dates on your calendar. And without further ado, I'm going to stop sharing so our presenters can get their slides up. Allan, take it away.
Sounds great. Thanks, Connie. All right. Well, I want to welcome you all to this webinar. So in today's webinar, we're going to discuss how to assess both evidence and cost data to help you decide whether to adopt, modify, or expand a program. And we're going to start with a brief introduction to the Pathways to Work Evidence Clearinghouse, and then provide you a brief website tour to show you where you can find information about programs' effectiveness and cost. And we're then going to provide some updates on some exciting work we've been doing on cost standards. So Amanda Danks is going to do the tough work on that one. So we're going to start with kind of making the case for cost studies. Why do we need cost standards in the first place? And then we'll walk you through at a very top line of what our cost standards look like. We're hoping to save about 25 minutes to talk about how you navigate program selection and cost trade-offs and what factors into decisions that you make when you're investing in new programs or modifying programs or expanding programs to new locations. So first, we want to give you a little bit of background information about the Pathways to Work Evidence Clearinghouse. Pathways to Work aims to support evidence-based decision-making to help people understand what works to improve employment-related outcomes for individuals with low incomes. So Pathways to Work is funded by the Office of Planning, Research, and Evaluation within the Administration for Children and Families within the HHS. And so I do want to point out here before we start that the content of this presentation does not necessarily represent the official views of OPRE, ACF, or HHS. This is really our discussion and kind of a free-flowing discussion about what decision-making looks like and not really an official policy position. So research clearinghouses like Pathways to Work gather studies on related topics. We assessed how trustworthy those studies are and then explain how well the programs work. So many studies on employment and training programs are they're hard to find. They lack quality in some cases. Sometimes they can be hard to make sense of, and then sometimes multiple studies kind of mix. What do you do with there's contradictory findings? So there's a lot that goes into the study review, and so our job is to gather, read, rate, and summarize a large number of studies to really help you identify what's working and give you quick, reliable answers to big questions. Some of these studies are also behind a paywall, so we recognize that in your jobs, it's not easy to find and use evidence at this scale, but that's what we're here for. So while Pathways to Work is supposed to be a valuable resource to everybody, it was developed with two key audiences in mind. The first are program providers and policymakers, which I suspect most of you here in the NAWB audience are. And we really try to provide clear, transparent information about what's working and really kind of help you make evidence-informed decisions. The second audience are researchers, and a lot of times researchers want individual study level results so they can kind of dive deep into some of the findings and also help set learning agendas for future research. Now, because a good portion of our audience are non-researchers, we really try to help people become just really more informed consumers of evidence. And so that's really our charge, and we really try to make the clearinghouse an engaging place to visit. So Pathways to Work was started with a congressional mandate in 2017. The project started in 2018, and the public website launched in 2020. So we came on board with Pathways to Work in 2023 as part of a new contract, and we've been working ever since to kind of improve the clearinghouse, update it, and build upon a lot of the good work that was done before us. So we are excited to share some of our new developments and really share the culmination of some of our work from the last 2 years. So this slide describes at a very top line what we do. So the first thing we do is we identify and review evaluations. So we use a documented process to find research and use that documented process to evaluate evaluations of employment and training programs. The second thing we do is we rate the program effectiveness and cost data. So this helps users quickly see what's working, what's not working, how strong the evidence is. And when we're reviewing program effectiveness, we're really looking at 4 different types of outcomes. We're looking at earnings, employment, public benefit receipt, and education and training. And when we rate cost studies, we're really looking for whether these cost studies have the critical building blocks in place to produce credible cost estimates. So after we rate the studies, we then summarize the findings at a broad level, and we share this on a very easy to use website to help make it very simple to digest a large amount of information in a very straightforward format. And then the final thing we do is we disseminate results. So this is part of why we're here today. So we're here to spread the word about supporting use of evidence in decision making. We realize that evidence clearinghouses are, it's not a if you build it, they will come kind of activity. It really has to be engaging. And we really have to engage in a two-way dialogue with the field to identify what the needs are, what the informational needs are, how we can package information, and then how do we get it out to you most effectively. So to set up the discussion of our website, we did want to lay out the kinds of decisions you can make using Pathways to Work. So the first thing to consider is, what do you want to do? Do you want to adopt a new program? Do you want to modify a program that you already have underway? Or do you want to expand a program or scale it up to a new location? So based on what you want to do, that may drive you to different products on our website. The other key factor is what factors affect your decision. So we have a lot of information on the impact of programs. We have a lot of information about the cost of the programs, and we're going to get much deeper into that. And then once we kind of evaluate this using a standard protocol, there's a lot of things that ultimately come down to local considerations. So as you kind of look at the evidence, you have to ask yourself, is there political will to fund this kind of intervention? Is there a need? Do you have time to do it? Are there facilities in place? Do you have the right staff in place to make things happen? So there's just a lot that goes into these kind of decisions. And so we really want to share with you kind of the art and the science of making these kind of decisions. So in this slide, we just wanted to highlight some of our products, key product lines, and then also I'm going to take you on a tour of the Pathways to Work website here in 1 second. But as you can see, there's a lot of products we have for program providers and policymakers. There's a lot of products we have for researchers. And then some of these products are really for multiple audiences. In our talk with users, we've had a lot of discussions, and we realize a lot of people out in the field wear different hats. And so one day you could be in a research function, the other day you're in more of a administrative function or service delivery function. And so we really want to make sure that the information is tailored, provided at a grain size that makes the most sense for you. And so I am going to share a screenshot of the Pathways to Work website so you can see what we do. So the first thing is that when you go to Pathways to Work, this is our homepage, which is really meant to be just kind of a user-friendly portal to a lot of information. So the first thing we really like to encourage people to visit is this Find Interventions That Work tool. This is on Pathways to Work to help you really down select the programs that make the most sense for you. So as you can see here, when we have 370 studies on 292 interventions, that's quite a bit. So in order for you to find evidence on the programs that make the most sense for you, we have a lot of filters here. So you can select outcomes that you want to improve, let's say increase long-term earnings. You can select characteristics that describe your clients. So we can say cash assistance recipients. And then finally, you have a list here of services that you want to make sure you offer. So let's just say for the sake of the argument, we have job search assistance. So if we apply those filters, we go from 292 interventions down to 7. So this allows you to really kind of dig deeper. So let's say we want to go to the Portland Jobs Program. You can see the results right here, right up front. And if you click on this, this will give you a lot of information about the program itself. It gives you quick information. We have evaluation findings right here by type of outcome, and a lot of details about implementation. So if you want to, let's say, adopt a new program, it makes a lot of sense to go to the findings. What are the most effective programs that really match your needs? If you're looking to modify a program, you may want to go down to a description of the services implemented. And if you want to scale up a program, we need to think about context. So here you can see it was implemented in Oregon. We have race and ethnicity of the program participants, or at least those who were researched. And if you want cost information, you can click on the View More and find out cost per participant here. We are working on a website update, and we're going to juxtapose the cost data with the effectiveness data. And that's hopefully going to provide a little bit more of a help you see things side by side. The second thing we have is population in focus, which you can see here. And this summarizes what we know about what works for a specific population. So here we have what works for young adults, and you can see we provide the most effective programs by each type of outcome. So earnings, employment, public benefit receipt, and education and training. And then we have individual program outcomes. We also have evidence snapshots under publications. And these are quick, easy to digest summaries of what works for a particular service approach, like career pathways. In addition to that, we have synthesis reports. And these are really reports that kind of summarize across the entire investment of pathways to work. So if you're looking for more of a big picture, these are great for policymakers, especially if you want kind of the big picture view, lay of the land about what we know about the research on employment and training. It's all right here. We also have evidence gap maps, and you can see them here. And this allows you to find out where the evidence lies and where the evidence does not lie for particular service approaches and particular outcomes. So you can click here, and let's say there are 18 interventions that have findings on short-term employment outcomes, and you can find them right here. So you can see that there's a lot of information here. If you're a researcher, this is my favorite feature. You can download the source data for Pathways to Work. You can download study level data, study by outcome. So there's usually multiple outcomes per study. So all your outcome data are right there. There's also intervention level data, which wrap up the outcomes to a program level. In addition, we have evidence standards. And as I mentioned before, we use common standards to evaluate all these programs. We're currently finalizing it. We're actually in 508 right now for a new methods and standards protocol version. And that should be up here pretty soon. And then finally, I just want to say that there is one additional product that is not on our website yet, but we're really excited about. And it's called Evidence to Practice Guides. So what Evidence to Practice Guides are is a guide that starts with the systematic evidence review. And then we convene a panel of nationally recognized experts to digest that evidence, come up with 4 to 6 practical recommendations, and then help us kind of identify in the guide what are each individual discrete step you need to implement that recommendation, what are the roadblocks, and then what are the potential solutions to those roadblocks. The magic and the magic behind the Evidence to Practice Guide is it really helps you implement practices, everyday practices at low or no cost. And so we're really kind of aiming in that guide to go for low cost modifications to practice that can really help drive impact. So I'm going to go back to my presentation now. And and from here, I am going to turn it over to Amanda Danks to talk about cost studies.
Great. Thanks so much, Alan. And I actually see a hand up. Lion, did you have a question for us?
I do. I came in late, so I apologize, and I'm fairly new to the Workforce Development Board. We just completed a program for Workforce New Jersey and have our research report. And I'm wondering whether you take outside research and integrate it into your database, or whether it's all your research. So, are you open to the results of our research?
Absolutely. So we have an annual call for studies where we ask the public to submit studies, but we also take studies anytime. So if you do have some research that you want to share with us, you can connect with us. There's a contact us section on our website. It's Pathways Clearinghouse at appglobal.com, and you can get to us, and we would love to take a look at it.
Great. We'd love to share it because we had some
Great.
really good results.
Oh,
Um,
that's perfect.
yeah. Thank you very much.
Oh, thank you.
Great. That's like the best kind of question to be asked. That's great. Thanks so much, Alan. Like everyone said, my name is Amanda Danks, and I work at the American Institutes for Research, and happy to be here with you today to talk about cost study standards, which are my favorite thing. So as Alan shared, they are currently working on a major website update, which will come earlier next year. As Alan pointed out, there is cost information there already, but the goal is to design the site in a way that it's going to provide you with an assessment of the quality of program cost estimates. Earlier this year in May, a draft of these cost standards were released for public comment in the Federal Register notice. And as Alan shared, we recently received final clearance for these standards from OPRE, so we're really excited about this milestone. In the remainder of this presentation, we're going to dive in and take a deeper look at the cost standards and discuss their implications for making evidence-informed decisions. So for some of you, I might not need to make this case, but hopefully by the end, you'll all be on board. Why do we need cost studies and cost information in the first place? So for this portion, I kind of want to make that case for you all as to why cost studies are important and why we really need to assess the quality of that cost information. So on the next slide, you can see a little visual here that helps us kind of think about cost studies. They're important first and foremost because they produce cost information to help users make well-informed investment decisions. Whether that investment is to adopt or modify a program or even expand it, make it larger where it is, or expand it into other places. Cost information on its own can be helpful to determine which programs are affordable and what can be sustained in the long term, given available funding, resources, and staffing. But alone, it's not sufficient to support the investment decision. We really need to balance the evidence on impacts with the evidence on costs, that combination can be a really effective strategy for communicating with policymakers as they must face these trade-offs in their work. And I'm sure many of you are familiar with those trade-offs that can happen. One example might be that the most effective programs are sometimes also the most expensive. And so if we select an alternative program that might be slightly less effective, but at a far lower cost, we might be able to reach more people, thereby maximizing our public investment. Cost information can also be used to determine which programs are even affordable and which can be sustained in the long term. On the next slide, what we break out here are the three main types of cost studies that can produce information that are useful to program providers and researchers. The first is a cost analysis, which is simply designed to estimate how much a program costs to implement. So how much does it cost? Cost analyses are focused on identifying the resources that are used to implement and sustain that program. So what is used to make that program happen? And then what are the costs associated with all of those resources? A potential next step that a study could include is a cost effectiveness analysis, which is really designed to help us understand the best choice among programs that are aimed at the same outcome. We often say that this helps us identify which program gives us the biggest bang for our buck. So for example, a cost effectiveness analysis can tell us how much it costs to get one additional person employed through a particular program. The final type of cost study is a cost benefit analysis. Many of you have heard of that term. And that's really designed to help us understand if a program is worthwhile to undertake. And it helps us guide choices among programs that are aimed at producing different outcomes. So maybe one gets people employed, one has an increase in housing, and another program has a different outcome. We can use a cost benefit analysis to look across all of those programs and identify which has the largest benefit compared to its relative costs. So for example, if we find that a program delivered $7 in benefits per person, but only required $1 of investment, then we would look at that and likely call it a solid investment. If a program evaluation reviewed for the website includes any combination of these studies, just to point out, they will be rated on each type of study as we go through, and you'll see more about that in a moment. So given the importance of cost information in program decision making, and we can even think about that in our own lives, the importance of understanding costs of different things. We also have the importance of cost studies for producing that information and the variation in cost study quality. The Pathways to Work Clearinghouse is finalizing some ways to make that cost information more prominent on the website, and the standards to review and rate the quality of the cost information for programs that are on the website. So in other words, we really want to make sure that users can quickly understand how much should they trust and weight the cost information that's on the website by telling them something about the quality that underlies that estimate. So we would like to share this information today with NOB members and both preview our draft cost study, or I guess now approved cost study standards, and also share some suggested considerations if anyone in the audience is reviewing any program cost information on your own. So in this next section, I'm going to give you a very broad overview of our cost study standards. We're not really aiming to give you the finer details of each standard, but rather a zoomed out view of the elements that should factor into a high quality cost study. And on the next slide, thank you. What I really like about our cost study standards is they're divided into two parts. So first we have threshold standards, which are just basic characteristics that cost studies must meet for the Pathways to Workforce Evidence Clearinghouse in order to allow us to then rate the quality of the study's cost analysis. These threshold standards essentially indicate that a study has the fundamental characteristics, that basic foundation that's needed in order to allow for accurate cost information to be generated. If a study passes those threshold standards, then that study then moves on to the quality rating standards. And those quality rating standards dive in a little more deeply to the rigor of the cost analysis or cost study to differentiate across three levels of quality, which you'll see on this next slide. This is a figure of our rating system that kind of helps break it down. So you can see on the far left, those threshold standards, if they're not met, essentially we would flag that on the website with interpret cost findings with caution. If a cost study does meet the threshold standards, then it moves into that quality rating phase where they receive one of these 3 ratings that you see here, either acceptable quality, good quality, or outstanding quality. These quality ratings let you know that the study has met the threshold standards and is thought to provide credible cost information. And then those 3 categories help you understand a little bit more about the quality of those cost estimates. A classic example, oh, thank you, I was waiting for that piece to pull up. A classic example of a cost study that will not meet the threshold standards, just an example, is one that uses only a budget to report costs. So as many of you know in your own work, a budget may miss resources that are used to implement a program, whether they are donated facilities, donated materials, or volunteered time. And so a cost study that provides estimates based solely on a budget is an example of one that would not meet these threshold standards. So like I said, we don't have time to go over all of the threshold and quality standards in detail. And I think myself and maybe a few other people on this call might be the only ones excited enough to actually go through those. So this is just a really quick overall, again, just kind of a zoomed out view of both the threshold standards and the quality rating standards, and some key things that I'd like you all to take away from our discussion. So first, in the threshold standards, we want to be sure that the program of interest is described really well. We really can't understand if all of the resources used are being accounted for in costs unless we have a full understanding of the program itself. So cost studies should give us a sense of the key program components, the number of participants, and when we think about cost benefit analysis or cost effectiveness analysis, we also want to understand the comparison conditions. So to what is that program being compared? Secondly, we want to estimate in the threshold standards, we want to be able to understand that the cost estimates are showing the value of all resources that are used to implement a program. We require that cost studies use a resource-based approach. So again, thinking about our budget example being a non-example, a resource-based approach simply means that the study accounts for all of the resources that were used to implement the program. So this often includes personnel and non-personnel resources, so staff who implement the program, office space and equipment. And again, typically we think of this regardless of how they're financed or otherwise provided or volunteered. Having all of this information helps us know that the cost estimate takes into account all of those resources that are used and then therefore accurately represents the true economic cost. We want to be sure that the cost studies provide a clear perspective, so kind of understanding from which perspective the costs are being estimated. It's important for us to understand that so that when we're comparing across studies, we understand that, maybe this study is looking at the perspective of a state, whereas this study is looking at the perspective of a county. And so those costs are going to be very different. So it's important that we understand from whose perspective the costs are being estimated. Lastly, for our threshold standards, and this is probably the most exciting one, we want to make sure we understand the per participant cost. That's really the common metric that we plan to use to report costs across all types of programs. So how much should it cost per participant to complete that program? Our goal on the Pathways to Work Evidence Clearinghouse is to report all cost per participant figures available, regardless of their rating. And as I said earlier, if a study does not meet these threshold standards, it'll be indicated as such on the website. So moving into our quality rating standards, which are on the right side of this table here. First, we want to be sure that there's enough detail about the prices that are used. So for each resource used, we want to assign an appropriate price. And so a reviewer needs to understand enough detail about those prices used to help understand if it will produce a quality estimate. Secondly, we want to be sure that the cost estimates come from a representative sample. So we know that in studies, we're not often able to interview or survey or talk with everyone who participated, but ensuring that the cost information is based on a representative sample helps us ensure that we're not just cherry picking the least expensive sites or cherry picking the most expensive sites, so that we have a good look at what the overall costs are. And then lastly, I think the other quality rating standards can kind of fall under this idea of reporting the dynamics of the cost estimates. So cost studies that conduct a sensitivity analysis really help signal that due diligence and exploring alternative assumptions. All cost studies have some assumptions baked in, whether it be assumptions around quantity of resources used or prices of resources used. And so conducting a sensitivity analysis of that helps a reader really understand how sensitive those estimates are to changes in assumptions. Our standards also require reporting of whether resources were fixed, variable, or lumpy. So these are economic terms that we could spend more time on, but really that helps us understand what's needed to scale up or scale down on particular programs. Do we need one computer per person? Do we need one caseworker for 50 people? Just kind of understanding how those resources are distributed. Finally, there are some standards that are specific to cost effectiveness analysis and cost benefit analysis. So the first is for cost benefit and cost effectiveness analysis. We want to understand information about costs arising from behavior changes in program participants. So for example, if a participant goes through a training program, they may be more likely to take on additional training, which can have additional costs. And so we want to make sure that that's represented in our cost estimates. And finally, in a cost benefit analysis, we talked about this in the very beginning, we want to make sure that the perspective being used to estimate benefits is the same as the perspective being used to estimate costs, so that we're kind of looking through the same lenses to estimate both costs and benefits. And so I don't see any questions in the chat, but now we'd like to turn to, oh, I'm sorry, Allan, this is for you.
It's all me. Thanks, Amanda. That was great. And now we wanted to kind of move the transition this from us giving you information to you hopefully giving us information. In our remaining time, we wanted your input about how you make evidence-informed decisions in the wild, so to speak, and how do you balance the effectiveness of programs with cost information. And what we're hoping for is to really walk away from this presentation with a really good sense about how we can best package information for you. How can we understand kind of what factors into your decision and really kind of make sure that we're connecting on both ends in the supply-demand equation. So before we kind of get into the discussion, I did want to kind of revisit this slide regarding what factors go into a decision. So for example, do your needs for information change when you're adopting a program or modifying a program or expanding it to a new location? And again, are there factors that are particularly useful in affecting your decision? And we're going to really ask you some questions in a poll coming up to really kind of interrogate this a little bit more. So, is there political will? Is that a big issue? What does the need look like? Is there time? Is there staff? Is there facilities? All those things that go into a decision that we need to think about. And we realize that there's no correct answer here, but when you're making decisions, it's really part science and part art. And so we're hoping that you can share with us a little bit of the art that goes into your side of making that decision. So we have a question for you, and there's going to be a poll that pops up on the screen, but our first question for you is, what key features do you look for when selecting or modifying a program? And you can select all that apply within this question. And Stacy, do the poll results come up on the screen, or are they going to, you're going to share those once we're done?
They are coming up.
Okay, great.
Right now, cost per participant is in the lead
Mm.
with 83%,
Wow.
50% administrative performance data,
Mhm.
54% services matched to participant need. Also up there with 57% resource requirements. It looks like the setting where research was conducted was the lowest with 7%.
Wow. That is a little surprising to me, actually. A lot of times when I ask people where do you look for evidence and what evidence matters the most to you, we have a saying that people look for local and focal evidence. So is it most relevant to your needs, but is it also, is that evidence produced somewhere locally, so within your context? We're thrilled to see the cost per participant being a high priority because we really want, and a lot of our efforts over the last year have been really designed to kind of improve the reporting of the cost per participant data. So we're thrilled to see that there. It's also interesting about administrative performance data because we realize a lot of times, even though we see a lot of research evidence and Pathways to Work is really focused in on evaluating randomized trials and quasi-experimental designs, a lot of times the only evidence you have to go on is administrative performance data. So, it's really balancing cost against evidence, and evidence can look very different. Pathways to Work gives you a lot of good information about what we call rigorous comparison group designs, but in the absence of other information, administrative performance data is totally good to check out. Are there any other questions or any other things, response categories that we may have missed that people want to share? And I have to admit, I don't see the chat. Here we go.
And if I
Any
could
other?
just add to one of the other polling ideas was resources needed or resources used. And just to note that that is, a part of a cost study as well. So understanding, how much staff, how much space, how much materials, how many, pieces of equipment might be needed. So all of that information is also included in a cost study. So I'm also excited to see both of those rank so highly.
Great. Great answers. We know there's no right answers, but we like those answers. We go to the next question. The question is, what audiences do you need to engage before adopting a new program? So here, what we're looking for is getting a sense from you about what is the social network of, or what are the people or the systems or the organizations or the entities that you have to go to, that you typically go to before you make a decision about adopting a new program. And this always gives us really good information. This type of question gives us really good information about who's in your ecosystem that you're talking to about these decisions. So I'll give it 1 minute and give you a chance to respond. And Stacey, if you don't mind, just let us know when you're ready to share.
Yeah, I'm going to end the poll now and share the results.
Great.
Hopefully you can see them. If not, I'm happy to read them out loud.
Great. Community-based, agency leadership, that makes a lot of sense. And community-based service providers in the public are tied. That's great. We assume that agency leadership would be kind of high up because in order to make decisions, you need purse strings to make those decisions. It's interesting that the public is involved as to that extent, because a lot of times we see community-based service providers are kind of that next layer to see, like, do we have the resources in the community to deliver what we want to deliver? But the public, of course, is the key audience. And so we want to, it makes a lot of sense to have them involved as well. Are there any other thoughts from people? Any other things? Feel free to use the chat or just speak up. Or are you all excited to go to the next poll question? We have one more for you. The board. Yeah, so agency leadership, boards, workforce boards, that makes a lot of sense. All right, if we go to the next question, we have a interesting activity here. So we have 3 programs, and we want to get a sense from you about how you weight these different program selections. So program A has strong effects on employment and earnings, but low cost, but it's tested in a single location. Program B has strong effects. It's high cost, but it's been tested in multiple locations. And then program C gives a little bit on the effects. So the question really comes down to how do you weight these 3 considerations? Are you willing to sacrifice a little bit of effects for a lower cost? Is the location of where the evidence was built factor into your decision more than cost or evidence? Really, it's about getting a sense from you about how you weight different considerations. So we wanted to pose this question and just kind of pick your brain about what you would do in that situation. Wow, that is as close to a tie as we can get. So program B and program C, it really is showing that we have a lot of, like, there's really it's a tough trade-off between the cost and the effects. And it makes sense because both of these are really important considerations, and we need to, a lot of times, I hate to say it, but cost and the cost of a program can really drive your decision for you. As a matter of fact, one of the best pieces of advice I ever got was from a college advisor who said, I'm not supposed to say this, but don't be afraid of letting the cost of the college you attend drive your decision. And so, it's just reality that we have to take cost into consideration, even when we need to sacrifice some effectiveness. Great. Well, thank you everybody for that feedback. That's great. And I did want to turn it over to and introduce you to Lorrie Briggs. And Lorrie is the Deputy Assistant Secretary of the Louisiana Department of Children and Family Services. Lorrie is also, very importantly, one of our evidence champions. We've brought together this group of 8 evidence champions on a quarterly basis. And the evidence champions are really prominent experts in the field who we engage to help us identify emerging needs, help refine our product lines for us, and really help us disseminate results. So the evidence champions are really kind of our eyes and ears in the field. They give us a good sense of how the audiences are going to react to certain products that we develop. And they're really so critical because ultimately for Pathways to Work, we want to create this really true two-way dialogue with the field to find out where the needs are and make sure that what we're doing is going to connect to those needs. So, Lorrie, I wanted to turn it over to you if you could provide some just reflections on what you heard today.
Good afternoon. I'm so happy to be here. And this work is very exciting to me. For most of my career, I worked in the direct services arena. where research and evaluation was operationalized. And over the last 5 years, I've spent most of my time working where research and findings drive budgets. And what I find so interesting is that we do this work in such a silo. And I think the opportunity here is to utilize this type of research to maybe bring the work together. When you're doing direct service work, when you're operationalizing, you have a finite budget, period. And you have to serve everyone, irregardless of how much money you have, irregardless about how many people come forward. So you get very used to creating research projects every day. What you do is you look at the performance measures that your team is required to focus on, and you try things until the needle changes. Things that don't work, you stop doing because you don't have the time or the capacity to do it. Things that do work and move that needle, you keep doing. And your hope is that your vision and your mission for your participants align with the performance measures in the best way that they can. That's why it's so important that people really create performance measures that honor both the participant, the direct service person, and what you really want. It's very important to have those decisions at a higher level of, you can't say this is about connection to work and how many people you connect to work. You have to think about a lot of other things. Like if you push everyone into working as a CNA, will you ever get people off of public benefits? Because a CNA job is never going to get people off public benefits. But as I've worked in higher level leadership, what I have learned is it's all about what Amanda said, the budget. And when you fail to really recognize how much things cost and where where the cost leaks actually are, you're really not focused on your budget. I see people pouring money into things that just don't work. So what happens is you pour the money into a technological system or a different model, and you never launch this work with the direct service practitioner or the participant, and you've spent millions of dollars on something that you abandoned within 5 years because it never moved the needle. It's very important to really do research at a high level and a low level and look at these studies and determine exactly what is your biggest bang for your buck. And I will always give an advice that if your work does not include strong case management, if it doesn't include some sort of navigation to help a participant when they're in time of need, and if it also doesn't include what the participant and the direct service person says that they can actually accomplish, what you will find is you'll keep paying that bill over and over again every year until you pivot and do something different.
That's great. Thanks, Lorrie. That was perfect summary. Thank you. And before we go, we did want to ask, does anybody have questions for the Pathways to Work Evidence Clearinghouse, for Lorrie, for us in general? Comments, questions? We are up for any discussion you may want to bring up. And I will wait about 10 more seconds, but if not, we can break and you can get 5 minutes back before your next meeting.
Hi, so it's Lucky, and I do have a question. It's a lot of information, and we know data is key, but because there is so much data, I'm fresh off a NASWA conference last week, right? I want to know if we need assistance in navigating. So, because I'm consolidating questions that I have to get to where I want to be. You may have some of the information on your site. It may not be there. But if we need, if we want to spend a little bit more time looking at it first and then reaching out, are you open to, maybe spending some time?
Absolutely. Yeah, we would love to hear from you because we've done extensive user testing on our website to try to really anticipate what the questions are, but we would absolutely love to talk to you if you do have any questions. The easiest way to get in touch with us would be you can go to our website and do the contact us, or you could just contact us directly at these email addresses. But we would absolutely love to help out any way we can, because yeah, this is needless to say, this is a labor of love for us, and so we do love to talk about pathways to work.
Thank you. I appreciate that. And I just out of curiosity, I'm not as in the weeds as you all are, but do you offer, is your UAT, is it just for your group? Or do you have sandboxes for other people? Like if we have a thought to be able to run it through, just to see if we can replicate.
Oh, sure. We would love any kind of feedback that you provide. So, but if you do want to participate in future user acceptance testing, we are more than happy to take volunteers.
Okay, thank you.
We're always looking for that.
I appreciate it. Thank you.
Thank you.
And we have another question from
Oh.
Lion, whose hand is raised.
There we go. Hey, Lyle.
Since I'm so new to this, I don't know about your organization. Are you a government organization? Where does your funding come from?
Our organization is a private research company. We do a lot of systematic evidence review work, but we are funded by OPRE and the Department of Health and Human Services. So it's a federally funded evidence clearinghouse.
Great. And so you do work not just in workforce development, but other fields as well?
Mm-hmm.
Great.
Yep. We cross over quite a few different areas, but yeah, this is really with Pathways to Work, we kind of like to think about our audience as kind of three different groups. We have a lot of TANF administrators that we're targeting for employment and training programs, a lot of American Job Centers and community colleges. And so trying to kind of make those connections between those sectors. You'll see a lot of the programs that we evaluate are really trying to work across those sectors.
Great. Well, I really appreciate your work and the information I got today.
Thank you. Thank you for coming. All right, great. Well, with that, I just want to thank you all for participating. This was great. And thank you for the feedback and the participation. It's always great to have this, and it always makes these presentations a lot more interesting when we have your active input. So thank you.
And if there's no more questions, I would like to thank you all for coming. Allan, Amanda, and Lorrie, thank you so much for sharing your time with us.
Pleasure.
We'll let you guys get back to your day. Don't forget to visit us at knob.org for any other events. Hope to see you all soon. Have a great day.
Thank you all. Have a good one.